When we found out that she was pregnant, it was as if I was pregnant again. I was that happy. Come in. Hello there. Hi. So today we're going to have a little chat about a patient that I encountered and with a very happy outcome. So this was a lady that actually presented to me with what we call secondary subfertility, meaning that she already had a child before this and subsequently had difficulty getting pregnant after the first baby. There can be many reasons for this. A lot of the time we don't know why it happens. In some cases it's because perhaps some couples put off having the second child a bit later. So as they age, the quality of the eggs and the sperm also reduce. In some couples, their lifestyles have changed since they've had the first baby. So some of them may be smokers, they might drink more alcohol, they may also lead more sedentary lifestyles, which may impact their fertility as well. So she came in after having failed some fertility treatments in other centers. So we performed an IVF cycle on her and we did a fresh transfer on this patient. Unfortunately, that fresh transfer was not successful. The patient was obviously devastated with the news, and through extensive counseling, we decided to proceed with a second frozen transfer. The second embryo transfer was actually successful, and she's currently pregnant. So basically, in this patient, the first transfer was not successful. The patient was even considering doing another IVF cycle. So we had a chat about how to improve her outcomes, and we are glad that the recommendations that we offered actually came up with a positive result. So one of the things that we talked to her about was actually reducing the amount of stress that she had. We told her that actually stress does have an impact on fertility, and we offered her sort of relaxation techniques and also ways for her to try and reduce the stress in this cycle. The other thing that we offered her was actually PGTA. So what happens in PGTA is that we actually take a very small biopsy, a very small bit of the cells within the embryo, and we actually check to make sure that the genetic makeup of the embryo is normal. Now, only transferring the normal embryos definitely improves your chances of implantation. The other thing that this patient did differently was that she decided to pursue traditional Chinese medicine, and she actually went for some acupuncture prior to her transfer. I think that for this patient, whatever she did was a recipe for success for her, and we were very happy when she had a positive pregnancy test. Medical professionals actually get very emotionally invested in their patients because this is a journey that we kind of go on together. When we found out that she was pregnant, it was as if I was pregnant again. I was that happy.